Hi, I'm Datuk Dr. Prethima Michael. I love regenerative medicine more than anything. Today I'm going to talk about how regenerative medical therapies can help joint health. I have done work with stem cells from 2006 when I've become a member of the International Stem Cell Association, and from then I've practiced stem cell or organotherapy in many different aspects, as an anti-aging, as in wellness medicine, in creating beauty for the skin, the hair, and also for joints. And I had the regenerative medicine department of the faculty of European College of Cosmetic Medicine and Surgery, and I've also done injections into joints from the time I did family medicine practice in Australia. And of course, subsequently I have sports medicine qualification, in which I have further enhanced my knowledge into how to deliver safe and effective stem cell or regenerative medicine treatments to joints. Okay, first let's talk about what causes joint problems. Many of you may not understand why your joint is suddenly very painful, or it's creaking in certain positions when you, for example, when you squat down and get up, or when you make movements of your shoulders or wrists even, or sometimes you may feel numbness in surrounding areas next to the joint, and also sometimes you may start to have severe pain in the sense that when you walk up and down stairs or getting up from a squatting position or going into a squatting position, there can be problems. So number one, knowledge is key. So we need to first understand what the pain or the joint problem is coming from. So for me, one of the first things I would do when a person approaches me with joint issues is to look at all their inflammatory markers and find out where this inflammation is affecting the joint. Of course, we could also go further and do a DNA testing, thereby understanding which pathway the inflammation is affecting their joint. Or it could also be lack of collagen production or premature breakdown of collagen, because joints, bones, cartilage, synovium, all of them need collagen structures to give the proper mobility and fluidity to the joint. So once that investigation is finished, we have kind of ruled out whether it's a rheumatoid arthritis or any one of the other collagen diseases arthritis. And then if we rule that out, then that leaves us with a wear and tear arthritis, which we call as osteoarthritis. So what is the precursors of osteoarthritis? Say for example, is the ankle or the knee joint or even hip. Sometimes a person's body weight has a big impact on that. So we say for every 5 kg increase of weight on top of your wanted body weight, there will be about 10 to 15 kgs of strain put on the joint concerned. And of course, wear and tear, as in women who are doing a lot of cooking or doing a lot of repetitive movement of their shoulders, or it could even be a lot of exercising without having the correct kind of nutrition. And sometimes people lose their joint mobility when they are too careful about what they eat. They are reducing their calories and they are not feeding their body sufficiently. As we all know, intermittent fasting is so famous now. A lot of people are fasting, but then they don't know how to break the fast. Okay, that's another story for another time. Maybe I'll talk to you guys about how to do it properly. But let's talk about joints again. So when we have these issues affecting the joints, one of the first things I do for my patients is to go through all those things that is causing the problem, because I don't want to straight away embark on treating the joint and then they have all those things still going on. That means my repair is going to last for a short period of time. Okay, what are the regenerative therapies that we have available? Okay, of course, the very minor treatment that you could do into the joint would be a PRP, or a platelet-rich plasma treatment. But for your information, platelet-rich plasma treatment is not stem cell. Okay, there is no stem cell inside. I'm not saying PRP is not useful. PRP is useful in the sense that it reduces inflammation immediately, thereby bye-bye to your pain. It also helps your body to create some good growth factors which will allow new blood circulation and new products to heal into the joint. But my main method of doing regenerative therapies into the joint is actually using autologous stem cell treatments, which I pioneered from 2011. I've done a lot of cases of autologous stem cells, and basically what we are doing is taking by syringe method, hand syringing, very small amount of fat from anywhere the patient could donate to me, and then of course upon diagnosis and upon understanding where the injury into the joint is, which I do with an ultrasound scan, and the ultrasound is not a normal ultrasound as in checking for a baby or abdominal ultrasound. Is a special ultrasound probe and a machine that you need to look into the joints. And we say that your injections of regenerative therapy will be as good as your ultrasound imagery. Why do I say this? Without an ultrasound guidance, I will not be able to put the stem cell, however exclusive the stem cell is, into the correct area of problem. So upon diagnosing and under the influence of the ultrasound, I'm going to get the stem cells that I created, which is the mesenchymal type, which we have plenty inside fats. So we are going to extract those, we are going to release those by digesting the fats and bringing the stem cell medium into the solution. And then sometimes I will also be adding some gels if there is a lot of joint space narrowing or there is osteophytes, etc. Then I'm going to mix these two together, the gel and the stem cells together, and then under ultrasound guidance I'm going to inject into the areas concerned. But what is the advantage of doing this? We have seen immediately on the spot pain and swelling go down. It's almost like magic, basically because there is a lot of healing factors as well inside this medium. So you find that immediately inflammation goes down, which is very important for the joint to heal by itself. And the second thing is we are adding gel or bits of fat as a way of scaffolding these stem cells, because if there is nothing to scaffold the stem cell, the challenge is you're going to have to do it multiple times. But how can we in one single treatment, or at the most 3 for the very damaged joint, how are we going to scaffold it? That's why we are adding the gel or fat material into the area together with the stem cells, so it helps first reduce inflammation, then start to sprout new collagen around the cartilages, which will kind of increase the lubrication which is coming from the synovial fluid, and even bony protuberances that is causing a lot of pain a lot of time to patients will all be healed as well in a course of time. So what does a person have to do after getting an injection like this? We are going to normally kind of reduce the movement in the particular joint by applying some compression dressings, and generally our idea is just to have normal movements of the joint but no heavy exercises for the first week, because we want a good perfusion and we don't want the inflammation to come back too soon. So we are going to limit the movement, and then I will teach my patients some rehabilitation exercises, or in the event where their muscles are too tight or too painful, then we do have some rehabilitation methods here. We have German equipment which can help to soften and relax the muscles around a particular joint, thereby increasing the fluidity of the joint. So guys, if any of you are having pain anywhere in your body, especially in your joints, please don't hesitate to contact us. The contact info will follow, because as in everything else, time is of essence. The faster we diagnose the issue and the faster we start to do whatever is necessary, the more you can escape all the aftermaths and the more serious surgeries that may follow if you leave it for too long. But even if you have joint narrowing and you're having clicking in your joints, you're unable to walk and bear weight without pain, then it's high time that you contacted us. Of course, the first step is going to be just diagnosis, after which I'm gonna go through with you all the other options that we have available. including we do have PRP from Regen, we have cellular matrix, we have cytokines, which are the precursors of stem cells. They are proteins that is signaling stem cells to activate. So, and as well as our star therapy, which is the autologous stem cell. So we are going to see a lot of improvement in the area concerned if you approach us in time.